Welcome to the Maternal Wealth Podcast, your space for all things maternal health, pregnancy, birth, and beyond. I am Stephanie Terrio, a labor and delivery nurse and a mother to 3 beautiful boys. Each week, we dive into inspiring stories and expert insights to remind us of your power in giving birth and motherhood. We're here to explore the joys, the challenges, and the complexities of maternal health. Because every mother's journey is unique and every story deserves to be told. This podcast is for entertainment purposes only. It is not intended to replace professional medical advice, diagnosis, or treatment. Always consult with your healthcare provider for medical guidance tailored to your specific needs. Are you ready? Let's get into it. Welcome to the Maternal Wealth Podcast. Today, we have a very special guest, Dr. Samantha Quézet-Lee. She is a chiropractor, a qualified yoga instructor, a former swimmer, and an Olympic weightlifter, and now mom. Dr. Quézet-Lee lives in Auckland, New Zealand with her newborn son and husband. I became intrigued by her journey as she shared a 30-day traditional Chinese confinement experience with her mother-in-law, Alicia. I reached out to Dr. Quézet-Lee not only to learn about her experience with a traditional 30-day postpartum confinement, because I admired her openness and her authenticity in her relationship with her mother-in-law. I believe your followers can see that as well. I'm excited to discuss your birth story and how you incorporate health and wellness into your postpartum life and with your patients. Welcome, Dr. Quézet-Lee.
Thank you so much, Stephanie. Thank you so much for having me on this podcast. I was very, very excited when you reached out to me.
Great. I'm so excited that you're here. I'm excited to see your little baby. Following you on Instagram and seeing you as a new postpartum mom with your baby and with your mother-in-law, it was such a genuine experience that I was excited to reach out and to hear that you wanted to be on the podcast. So thank you so much for being here.
Thank you so much for having me. I've also gone through and listened to some of your previous episodes, and it seems like such a healing podcast for new moms to be listening to. So this should be really interesting, and I hope somebody can take some positivity or some experience away from my journey as well.
As much as I love a birth story, I love a good love story. Would you share with us how you met your husband?
Yeah, that's a good one. So my husband and I actually met in high school. So we've been together for over 10 years now, and he's the year, or I don't know if the states do grades, but we do years in New Zealand. So he's the year under me, and we met at an after ball. We have a party at the end of the year for all of the students where you get all dressed up and go all fancy. And so we had an after party, and so we kind of met at that after party, and he pretended like he didn't know me. After, like, he was like, oh yeah, like, what happened? I don't remember. I was too drunk. And I was like, okay, never mind. And then he was like, just kidding. And I was like, oh, goodness. Okay. But obviously, when boys seem to treat you a little bit mean, you seem to want to go back to them. So I was a little intrigued. Not that he does that now, but just when you're like 18 years old. So I went back and I was like, hey, like, we should hang out. And I really was the one who led and drove it. And for him, being in a Chinese family, he did not think that he would ever end up with a European woman, you go down the traditional route, you marry a Chinese girl, and you have the Chinese babies, which has not been the way his life has worked out. So that was one of his biggest pattern interrupts of his life, I think. And yeah, so then we just started kind of dating after that, and I got to meet his family, and our families are actually very, very similar. We're both Catholic, or both families are Catholic, and we have very similar values to one another. So our families became very good friends, and that just added to our story, I think, because once the families became friends, it was just so much easier for us as well.
You are both chiropractors, correct?
Yes.
Did you go to school together?
Yeah. So I was the year above him. So when I graduated, I wanted to become a medical doctor.
Mm-hmm.
So I started on that journey. And then I very soon became very disillusioned with it and realized that it is not something that I want to do, because to me, it wasn't healthcare, it was more sick care. And I wanted to be in the healthcare industry. So Alo asked me, I was really into the nerve system and the brain. And he said, well, hey, chiropractic's a lot to do with that. And it's also a lot to do with salutogenesis, which is the prevention of disease, and the focus on health and well-being versus the focus on sickness. So I looked it up and very quickly fell in love with the whole philosophy of chiropractic. And I joined in with him. So then dropped out of the medical studies that I was doing and joined him. We ended up being in the same year together, and we did our chiropractic studies together.
As a chiropractor, how do you incorporate your care for your patients prenatally?
Prenatally, because my practice is slightly different to the regular chiropractic practice, I did a little bit of extra studies around like pre and postnatal care for women, because I am quite interested in movement and how that help heal your body as well. So we incorporate a lot of prehab and rehab into our care plans for people.
Mm-hmm.
If you don't mind me going a little bit into what chiropractic is, then that would give an understanding of why it's so necessary prenatally and postnatally.
That's great, because I think a lot of women would benefit from hearing this. When women are pregnant and they have obstetrical care, they don't really have access or understanding the full scope of practice of chiropractor care. So I think that would be great for our listeners to hear.
Definitely. And especially if you're in the States, there's been a lot of stigma around chiropractic care because of the history of the American Medical Association. And there's a whole bunch of history, but I'm not going to get into that. I'm going to focus on today's kind of research, which shows us that chiropractic care is really beneficial for our bodies because of the way that it works, right? So a lot of the time you'll hear people going to the chiropractor because they feel misaligned, which is not really the correct terminology these days. It's more what current research is showing us is that joints don't just misalign. They go through their normal ranges of motion, and then due to various traumas, they become stuck in one of their end ranges of motion.
Mm-hmm.
And so the main way that our brain actually communicates with our body is by getting that input of movement. So if you're not moving, your brain doesn't really know what's going on with the rest of your body.
Okay.
And so then it leads to poor output. So if your brain's getting all this garbage in, it's then going to have garbage out. And that means that muscles in that area are going to become really stiff and tight and guarded. You're also going to get a lot of inflammation in that area because of the lack of movement. The receptors to the muscles around that area start to turn off, and that leads to common aches and pains that we kind of experience in today.
Mm-hmm.
So that's kind of why chiropractic in pregnancy is so useful, because the demands on our body is increasing. Demands in pregnancy, your body is consistently getting or having extra demand placed on it based on the weight, based on the different hormones that are surging around you, based on the emotions that you're experiencing. So that can lead to the different joints in your body becoming a little bit stiff and stuck, right?
Mm-hmm.
It also increases the pressure on your pelvis. So when you are able to get adjusted, it reduces the pressure and increases all the comfort around your body, especially as your baby's growing.
How about benefits with chiropractic care? Does it help with facilitating descent of the baby to increase your chances for a vaginal delivery?
100%. So if you think about it, if your pelvis is like a closed, like a circle essentially, and that circle is constantly like moving and shifting, and if you get one area of that circle which becomes kind of like shifted, but then it doesn't shift back, then it's not going to allow for a good outlet for that baby to come down and settle down into the pelvic outlet. Once you do have that shift, then all the ligaments and the muscles have to accommodate for that, and they become stiff and stuck and push on baby. So there's actually a technique in chiropractic care called Webster technique, which helps to adjust the pelvis so that it can move appropriately, but then also release the ligaments and the muscles around the area so baby can descend down more effectively, which then obviously promotes a vaginal birth, which is what we're going for.
It's great for women to be able to hear that there are other means in which they can get services in chiropractic care to help facilitate fetal descent and get the baby in a good position. I'm not sure about what the cesarean rates are in New Zealand, but in the US, they're very high. And a lot of the C-sections end up with failure to descend, arrest of dilation. And I think if women had more access or were more open to chiropractic care, it would combat that and help women be more successful in having a vaginal delivery.
Definitely. And especially babies who are breech, the technique that we use is really successful with that. So if any moms are listening and they find that their baby is breech, I would highly recommend going to a chiropractor who is Webster certified and letting them work their magic. And if baby decides that they really don't want to flip, that's okay. There's usually a reason why babies don't want to flip. There might be an issue there, but a lot of the time it is because there's just not enough space in the pelvis, because usually in today's world, we're working at desks, right? We're sitting majority of the day. So the tension around our pelvis is high.
For breech presentation to have the baby flipped, is there a certain gestational age in which it becomes too late?
It's honestly never too late. I've had mums who are like a few days out of their due date and we've used Webster and the baby's flipped. But in saying that, obviously, the more care that you have under your belt, the easier it is going to be for your body to adapt, right?
Mm-hmm.
So if you are breech and you're waiting to the last minute to try flip your breech baby, it's a bit harder because you might need more care for your body, but there is no cutoff date.
I would love to hear about your birth story. I'd love to hear about how you found out you were expecting and if you decided to go with OBGYNs or midwifery, and then also with your background as a chiropractor, how you incorporated what you know into your pregnancy and labor and delivery experience.
Perfect. So my pregnancy story kind of starts last year, October, and I felt pregnant and we found out, and within 3 days I lost the baby. I didn't realize how distraught I would be for such an early loss. I was only 6 weeks, but I was very, very upset, and I don't know. Yeah, very emotional about it. And then was talking to, at the time we had an acupuncturist in our practice, and she was like, hey, like if it's meant to be, it will be. And I felt that deeply. So I was like, okay. And I started, this is going to sound very woo-woo, but it's part of my journey. I started seeing the number 11 everywhere. And I was like, this is really weird that I'm seeing 11. Like just randomly it would be like the time would be 11:11 or whatever. And so I started to realize like, oh, like I have the numbers 11 kind of scattered through my life, because when I lived in South Africa, we lived at number 11. I currently live at number 11. My parents live at number 11. And my wedding date was the 11th of March. And I was like, oh, this is kind of weird. And so I talked to the acupuncturist about it, and she was like, oh, 11 is supposed to be an angel number, meaning someone is there and looking after you and guiding you, and everything's going to be okay. Okay. And I was like, okay, that's interesting. And then I fell pregnant, and I kind of just knew right away that I was pregnant. And I went to my acupuncturist and I asked her, like, hey, because I don't know if you guys know this, but they can read your pulse and find out if you're pregnant or not.
Really?
Yeah, it's super interesting.
Yeah, I love it.
So I went to her and I said, hey, like, could you check my pulse to see if I'm pregnant, and how soon after, having sex can you decide? And she was like, oh, probably like 3 weeks. Why? How far are you? And I was like, oh, like 3 days. She was like, okay, I will double check. And so she felt it and she was like, I'm not too sure. Come back. It's not strong enough for me to feel it yet. Maybe come back in a week's time. And so I came back a week later and she checked my pulse and she was like, yeah, I'm 80% certain that you are pregnant. So this happened to be the day before Christmas Eve. So I went and took a pregnancy test and it said positive. And I was like, oh my gosh. But from my last experience, I was a little bit hesitant to get too excited just yet. But then I gave my husband a little present on Christmas Eve morning, and it had the positive pregnancy test in it, which he freaked out at, which I'm sure a lot of men do, which is great. And yeah, so after that, every time I got a little bit nervous, every time I was nervous, I'd check my phone and it was 9/11, 1/11, 11/11, and I just felt a little bit more calm around that. Because I just, there's a bigger plan and everything's going to work out. Whether it was true or not, it just made me feel calm. And I'll get back to the pregnancy, but had my birth, was in recovery, and my husband said to me, well, you'll never believe what number you're at in the recovery ward right now. And I was like, what do you mean? And I looked up and it said number 11.
Oh my gosh, I just got the chills. Wow.
No way. And then we went up to the room, right? And as I walked into the room, I looked at the number and it was number 11. And I was like,
oh my gosh,
what is this? Like, what is life? I don't understand. So I was always so convinced that he would be born at like 11/11 or on the 11th, but that didn't happen. But so that's a little bit of my woo-woo side, where I just, anytime I see the number 11, I'm like, yeah, I know everything's going to be okay and it's going to work out the way it's supposed to.
Yeah. Wow.
Not that this was about that. Sorry if I've veered off a little bit, but.
No, I love it. I agree with you in the numbers. And for my sons, they're all born on the 6th, August 6th, September 6th, and October 6th. And it was all natural, like crazy. It just all just happened that way. Numbers are so ingrained in people's lives. I had a patient recently, they named their daughter 7. 7 was just their number and it shows up everywhere. And I love that happened for you. Do you feel like, is there somebody out there that's watching over you, or you just think it's all interconnected?
I have always, my whole life, felt my uncle, he passed away when he was quite young. I mean, he was a really important figure in my dad's life, but I just always felt his presence randomly. And actually, Zandre's name is a combination of his name, which was Andre, and my father-in-law, who passed away a couple of years ago unexpectedly, Alexander. So we kind of combined the Alexander and Andre into Zandre.
It's nice to believe that it's all connected and it's all going to be okay, that you have those signs. So I love it. If you could chat a little bit about how you are a chiropractor and you incorporate the care and the knowledge that you have into your own pregnancy, and then about your labor and delivery experience.
Yeah, for sure. So being a chiropractor and having a husband who's a chiropractor, I have very easy access to chiropractic care, as well as we have our own practice, which we also have an acupuncturist there. So getting acupuncture and chiropractic care was quite easily accessible for me. And every week through my pregnancy, I did get adjusted because I knew my body was changing every week. So those adjustments just helped me to integrate those changes quite rapidly. The one thing that I did experience while I was pregnant even through my adjustments, adjustments aren't like the be all and end all, like it helps your body to adapt, but your body is still adapting. So you still will experience a little bit of discomfort as your body is changing. And for me, that kind of came in the form of lower abdominal pain, but just tightness and kind of lightning crotch, I think we call it.
Yes.
Did you experience something like that?
Yes.
I literally remember walking in the mall and the lightning crotch just like pinged, and all of a sudden I was like dragging my leg, and my mom was like, "Oh my God, are you in labor?" It's just so uncomfortable. But when something like that would happen, I knew like, okay, it's usually at the end of the week when I hadn't been adjusted for a week. So I went and got adjusted and helped to release all the ligaments and all the tension around that area. And that was super, super beneficial for me because I was able to walk around again without looking like I was giving birth every 2 seconds.
Did you hire an obstetrical team? Did you go with the OBGYNs or did you have a midwifery team?
So I went the OBGYN route, which is very different in New Zealand. So in New Zealand, women predominantly get midwives or have a midwife assigned to them because you don't really have to pay for the midwife, or you have to pay very small amounts, like within the hundreds of dollars. Versus if you go with obstetric care, then you have to pay privately. But the reason that I went with obstetric care was, there's a few reasons. One, I was just really nervous about baby, having had the first miscarriage. And I just wanted somebody there that if anything went wrong medically during the birthing process, they could do everything. Like if they needed to do a C-section, they could do the C-section. If they needed to give me a blood transfusion, they could do that right there and then. And because it's very common for women to give birth in like a birthing unit here. And then if something goes wrong, they get transferred to the hospital.
Okay.
Being in practice, I get a lot of stories from women around their birth and their labor. And I think that just kind of made me a little bit nervous, especially because in the area I am at, if you got assigned a midwife, the hospital that you would go to would be our local hospital, which I am not a fan of, based on the stories that I'd heard coming out of there. So I decided to go with obstetric care because I would then go to the main hospital in Auckland, which is Auckland Hospital. And I just felt like their care, I had better stories coming out of that hospital than I did from the other one.
When it came time to have your baby, did you go into labor? Were you induced? What happened?
I went into labor naturally. I actually think it was probably because of the acupuncture that I had had that day. In acupuncture, you can do an induction series from 37 weeks.
Okay.
And I started very late because when everything's easily accessible to you, you just think you'll have it forever. And I was in week 40 and I was like, okay, I need to start my induction process now. I was due on the Wednesday. I saw her on Wednesday, I think, just for regular induction. On the Friday, she did electric stimulation with the needles. And she was like, this is pretty intense, so I'll be surprised if you didn't go into labor after this. And the next day, I was in labor. So
Okay.
I think that may have hurried things along for me.
I'm curious, for the acupuncture with the, how would I say it?
Yeah, so it's an e-stim, so electric stimulation. Yeah.
So with the electric stimulation, I'm just curious with like the anatomy. Do they put it in your back, in your arms? Like where is, or I don't know, on your belly? Like where do they do it?
Great question. It's definitely not in your belly, which would be so nerve-wracking, having needles poked into your belly. Oh my God. During pregnancy, after pregnancy. Okay. So the main points that she did for me was like around my arms, my feet. I think I had in my back as well. And my neck.
Okay.
Yeah. So she kind of does like a range, but with the specific electric stimulation one was my lower back region that she put those needles into.
So you go into labor and then you get to the hospital. How dilated were you when you got there?
I was 3 centimeters.
Okay.
I mainly went in because I was bleeding, so I got a little bit nervous. And then she checked me and she's like, no, this is the start of labor. You can either stay at the hospital, we can break your waters, or you can go home, rest, relax, do whatever you need to do, and then come back when things get a little bit more intense. I wanted to go down the natural route as much as possible. So I didn't want to break my waters. I was like, my body's going into labor naturally. Let's just let this pan out how it's supposed to. So I came home, had a shower, had breakfast. I was supposed to have a wax appointment that morning, but did not go to that.
Can you imagine getting a wax when you're in labor?
I think like you won't even feel the wax during the contraction.
Seriously?
Just wait for the contraction. Okay, go. Yeah, so instead I just came home and relaxed. No waxing.
At what point did you decide to go back?
So I went into labor at 2 a.m. 6 a.m. I went the first route to the hospital. And then by 2 p.m. I was back at the hospital. That's when labor was kind of amping up for me. When I'd got to the hospital at 2 p.m., she was like, cool, you are 4 centimeters dilated. And I was like, great. But I was fully effaced.
Okay. So that's great.
Yeah, so that was a positive sign. I knew, okay, this might be a long process, but I'm fully effaced. It'll happen when it happens. It's okay. So that was 2 o'clock. And then by 5 o'clock, she checked me again and she was like, you're still 4 centimeters dilated. And she's like, I think we should break your waters because he's still very high. And maybe if we break the water, he can descend, put some pressure on your cervix and you'll dilate a bit further. So I agreed to that. And after breaking my waters, labor just got the most intense, way more intense than I ever thought that it would. And so from 5 until 9 p.m., I was beyond agony, like got to 100 out of 10 on the pain level.
Yeah.
Started vomiting, was like convulsing. It was just really, really intense for me. And she came back in and she checked me and she's like, well, you are 5 centimeters dilated. And I was like, oh my God, I've gone through all of this to only be 5 centimeters. That's only 1 more centimeter. So it was quite disappointing. And then we got to about 11 p.m. and she came in and she was like, hey, I think your body is just absolutely exhausted. You're still at 5 centimeters and you're exhausted. I think we need to get an epidural so that you can just relax. I think it's your best bet at baby kind of coming down naturally and us doing a natural birth. Obviously, I know the more interventions that you add, the more likely you are to have a C-section, which I was trying to avoid.
Mm-hmm.
But at that stage, I didn't feel resistant to it. It felt like it was supposed to happen. So I accepted it. I wasn't upset. I just went with the flow. And then at about 1 p.m., she checked me and she was like, cool, you're 8 centimeters dilated.
Okay.
So that was a positive. And then she's like, we'll give you some more time. Came back at maybe, like just 2:30. And she was like, you're still 8 centimeters dilated and baby hasn't come down or hasn't descended any further. Goodness.
Yeah.
Okay. And she's like, I'll give you some more time, but I think you need to start to consider that we may need to do a C-section here. And Xandre's heartbeat had started to become a little bit erratic as well. And so I was a bit nervous about that, but I was like, nah, it's all good. I'm going to get up and wiggle my bum and he's going to descend down. Me and my epidural got up and wiggled around for an hour and a half. And she checked me again and she was like, no, if anything, he's moved up.
He did not want to leave.
Yeah, he just wanted to hang out and not enter the world. Just wanted to be with me all the time. So at that stage, my obstetrician suggested that we do a C-section, and it felt very natural for me to say yes at that stage. Like I've done everything in my ability, and I can see I was also watching his heart rate and my vitals, And I was like, before we have to go into a massive emergency situation after in a few more hours, potentially, I would rather go with what she was suggesting, which was the C-section. You always hear about how C-sections are the easy way out, but that was definitely not my experience at all. Being in that operating room was so, I don't know if it was also because I just gone through a bunch of labor, but being in the operating room was very intense. Essentially, you're like strapped down because you have your blood pressure on one arm, you have your IV going through the other arm. They put a sheet up in front of you, and he had put the medication through the epidural line. And then they just use ice to check how numb you are. And I wasn't numb on the left-hand side, so they had to roll me over to one side to allow the medication to numb me on the left side. And I just remember thinking, oh my God, they're going to cut me and I'm going to feel everything on the left side. I was so nervous, but they cut and I couldn't feel it.
Okay, good.
But you can feel their presence. Like their presence is very much known in your body. And the tugging and the pressure sensation was very overwhelming for me, even though you're not getting pain. Then the big thing that occurred was when they said, you're going to feel like an elephant sitting on your chest. You're not going to be able to breathe for about a minute. And I was like, oh yeah, I'm going to be okay. That's okay. You've told me what's happening. But as soon as that happened, like literally like it's like I'd been winded and I just couldn't take a breath. I just remember looking at my husband saying like, I can't breathe, and just was crying. And he was just holding my face saying, it's going to be okay. And I think essentially they were just they had to really push him down. And then he came out, and then they spent another 45 minutes cleaning up, taking the placenta out, sewing me up, etc.
And then how did he come out? He came out crying?
No, he came out just like super happy, looking at the world, very alert. That made me nervous because I couldn't see him. I was like, he's not crying. Why is he not crying? They're like, don't worry, he's fine. He's just checking out the world. We did some delayed cord clamping, which is a standard practice in New Zealand. I'm not too sure if it's like that in the States.
I think it depends on providers. I think if you ask for it, they'll do it for you, but it's not something that they'll just willingly do for you.
Yeah, so we did that, and then Aloe got to cut the cord, and then he started crying. He was ready after that, and they brought him to me, and yeah, I got to name him. We were trying to figure out names at that stage. As soon as I saw him, I was like, yeah, he's a Sandre.
So many women will say the C-section is the easy way out. It's not. It's hard. There's a lot of dynamics that go into it that we don't think about until we're in the OR and having surgery. And the fear that you talk about, having the incision and feeling it, it's a real fear, because there are many times a situation in which a woman is in labor and then they have to have a stat C-section and there isn't adequate coverage and they continue on with the surgery. And unfortunately, that does happen. So the fear that you have is real. And I'm glad that they were able to adequately cover you so you didn't have to go through that.
Yeah, definitely. The one thing that I did get, I was allergic to the morphine that they gave me afterwards. I getting really, really itchy. I was a little bit itchy with the epidural, but with the morphine, I wanted to scratch my skin off and I had to like hold myself down, so I didn't.
Mm-hmm.
And then I started vomiting uncontrollably. And so they came in and they wanted to change it to oxycodone.
Mm-hmm.
And once they changed it, it was 10 times worse.
Oh.
And so I was vomiting more itchy, more shaking, and it was just awful. Having a C-section was definitely not very easy for me at all. And obviously the recovery that comes with it afterwards is very, very different. I mean, my sister-in-law just had a baby the week before. She had a baby naturally. Baby came out within 4 hours. No pain relief, easy. Versus me, where everything occurred and it literally took me 4 weeks to be just moving around properly. But for her, within like 4 hours, she was up and about and easy to move around.
It's definitely two separate modes of recovery, having a vaginal delivery or a C-section.
Definitely, yeah.
Let's get into the postpartum confinement period. I'm excited to hear more about that. How did they bring it up to you when you got pregnant? Was your mother-in-law like, we're going to do this? Were you ready for it? Were you apprehensive?
I always knew about, or not always, once I had kind of come into Alo's family, his cousin had got pregnant a few years ago and she gave birth and she went through confinement. So I was already introduced to the idea of confinement back then. I didn't obviously know what it really looked like and the ins and outs of it, but I understood that, you're not supposed to shower for 30 days. That's the biggest one that all the aunties talk about. They're like, "Oh, you ready to not shower for 30 days?" And it's like, because obviously it's a bit intense, but, and then all the confinement foods. So we talk a lot about the confinement food. So I already had the idea of what it was going to be like. And my mother-in-law, when I did get pregnant, was like, "Yeah, you're going to go through confinement. If you want to, I'm here to help you." And which I took up because I'd also seen my sister-in-law go through it a year or two ago. And I saw the way that she recovered from it and the care that went into it. And for me, it was like, you're going to get a whole bunch of nourishing foods. You're going to get somebody who looks after you 24/7. You get to sit and bond with your baby. You get to bond with your family. It was like, why would I not follow this?
I think that's one of the special things that you can see in your journey is how you talk about having somebody take care of you and bond with you. And when you have a birth, it's a birth of a family. So your son came into the picture and then you get to experience that with your mother-in-law and your husband in a new unified family. I really appreciate the interaction between you and your mother-in-law, and you can see the love and you can feel the love, and being in an interracial relationship and an interracial family and you embracing this culture. It was just a really beautiful thing to see. What made you decide to want to put it out there for the public to see your journey?
Initially, I didn't want to, actually. It was my husband who really pushed me to do it. And I was very, very resistant towards it. I didn't really like how I looked after birth, and I hadn't showered, and I was exhausted. I didn't like listening to my voice on the videos. I was worried about what if people say negative things about our family. A whole range of, those things that you tell yourself that why you shouldn't be doing something. But once I had pushed through and I'd got like one video up and then the next video up, and I started seeing the impact that it was making and hearing a lot of other women's stories and how they were interested in my story, I realized that it was a much needed content on the internet for people to kind of get a bit of cultural understanding of other cultures, and also change the narrative around postnatal care and the relationships that you can have with your in-laws as well.
I like how you say change the relationship with postnatal care. In many cultures, women are expected to give birth and then get right back to it. And we do need that time to heal physically, emotionally, spiritually, not even just with ourselves, but with family who loves us and wants to be there and wants to care for us. That resonates with me. I'm going to probably not do well with the name of this, but the Bach Fawn pills, the strengthen uterus, the
Yes.
little pills that did you take those every day or was it a one-time thing?
So there's two of the pills.
Okay.
The first one is the Sohap pill. And then the second one that I took was the Bak Fong pill. They're for different things. So the Sohap one was for the first week, and it's supposed to help you with like dispelling wind, and Chinese medicine believes that once you give birth, you have a lot of like wind in your body, essentially, which I ended up having a lot of wind. I don't know if other women experience this post-birth, but I was super farty, like my whole family. But I don't know if those pills like really helped to push it out or they were creating the wind, but it came out quite a lot. So the SOHUP you take for the first week, and then I had a week where I wasn't taking any of them based on the schedule that I had for my confinement. And then the third week was when I had the Bakfong pills as well.
I'm just curious about the Bakfong pills to strengthen your uterus. Is it to like clamp down the uterus to help prevent the postpartum bleeding?
It's a good question. In Chinese medicine, the concepts have been translated into English, right? It's very difficult to understand that concept of like strengthening the uterus or dispelling wind and coldness through the body, or dampness is a very, very common thing that they say. That translation and the understanding of the body is very different. But what I would think, if we were translating it into Western culture, like strengthening the uterus to me would be helping regain like blood supply to the uterus.
Okay.
Or increasing the blood supply to the uterus, helping with the contractions, the smooth muscle activity there as well as just providing you with like good nutrition to replenish that area.
The first baby bath. I love the idea of putting breast milk into the water. That's definitely a new concept for me. And then when I saw that, I was like, that's such a great idea, right? Because you're ingesting the breast milk when you're feeding, and it has valuable resources in the water when you're bathing. And then also what surprised me was the Guinness.
Yes.
How did that come about? Actually, it's getting cold over here. So me and my husband at the end of the night, we're enjoying Guinness right now. So I'm curious, like, how did that come about?
That's a good question. So the Guinness thing isn't really a Chinese confinement tradition, I don't think. It's more of a like Malaysian, Singaporean tradition. So
okay,
my mother-in-law isn't purely Chinese. She's Chinese Malaysian. So she was born and raised in Malaysia through Asian or Chinese traditions. And within her family, they always used Guinness for the first couple of baths for baby, first 3 baths. And that's just been a tradition. It's just something that they always did. As you would hear in one of the videos, we said, why Guinness? And she was like, I don't know, it's what my mother-in-law did and what my grandma did, etc. And I guess if you think about it, Guinness has live cultures within it, right? Which be contributing to the baby's microbiome potentially is my thought around that on their skin. And it might just be a little bit more gentle than using chlorinated water or the treated water that we use from the tap, right, for a baby bath. And I think the idea is also to prevent rashes. So a lot of these traditional practices, they're rooted in truths, right? So they found that if you use this seemed to help with this certain thing. So like the same with the red date tea that I drink, they found if you drink red date tea, it seemed to help with lactation. And now there's some research to support that. Whereas Guinness baths, I'm not too sure. They're going to do research around that.
Was there anything that surprised you in your 30-day confinement journey that you really enjoyed that you didn't think that you would initially?
Not showering surprised me that I enjoyed not showering. And I will clarify this a little bit, because not showering doesn't mean that you aren't allowed to wipe down or have general good hygiene, like brushing your teeth, washing your hands, etc. It was just like not getting into the traditional shower and immersing yourself in water and then coming out into a colder environment than that shower, because your system is already immunocompromised. So when you have that change in temperature, there's a potential for you to get sick. But eliminating the shower from my day-to-day, and I just did a small little wipe down, it actually helped me to have a lot more time in my day and also not worry about showering. I don't know. Sometimes as a new mom, you're like, you have 1,000 things to do that day and you're like, oh my God, I haven't showered. And you know, that's just like, it's another thing to do, even though it is something that will keep you nice and clean and you feel great afterwards. In that beginning stage, I was just so exhausted after having the labor, then the cesarean, then the reaction to the drugs, and then a newborn baby who needs to feed every hour and a half. It was a lot. And so just focusing on eating and sleeping and feeding my baby and minimal hygiene practices was really a bit of a load off for me.
That resonates, and it kind of brings me back to my early postpartum time where all day you're just doing all these things and focusing on the baby. And you're like you said, oh my goodness, I didn't shower. And then it kind of is like stressful. It becomes a trigger. And in the confinement period, you're not showering. That just kind of takes that stress off.
Within the confinements of confinement, it is a socially acceptable thing to not do, to not shower, to be a little bit gross, a little bit grotty, like a little bit oily, just basking in your own oils. So yeah, it's just taking that stress away. Whereas if you weren't doing confinement as a new mom and you didn't shower, people would kind of look at you and be like, "Ew, you're disgusting. Why haven't you showered? Why haven't you done this? Why haven't you done that?" Like adding to that mom's mental load.
I like that. Anything to take off the stress in the first months of the postpartum period to support the mom in her recovery is great. I wanted to ask you about one of my favorite videos was you eating the bird's nest, the bird saliva.
Yeah.
Do you want to tell our listeners just a little bit about that, what the bird's nest is and what it tasted like and the benefits?
Yeah, of course. So I might be lacking a little bit on what benefits are. But it's as part of the regime, you consume bird's nest, which for people who aren't familiar with what that is, it's the spit of a sparrow, essentially, and that they use to make their nest. And so they harvest that from the nest itself, not from the bird. And it kind of comes out like little stringy jellies, if I'm describing that correctly. I was very nervous to drink it, although I have all these other random foods that I've been introduced to through my family. But for that one, for some reason, I felt super nervous because I was like, ew, it's saliva. Like, that just grossed me out. But it was actually very sweet, and it was just like eating little jellies. So when you go through confinement, you get this pack of like herbs and the soups and the bird saliva as well, or the bird's nest, and it lets you know like what's the benefit behind it. It's suggested to have multiple times through the confinement, which yeah, maybe now that you brought it up, I'm probably going to go do a little bit more research around what the benefits are around it. But it really tastes nice. It's like a little dessert, not super sweet, and through your confinement, you're not having traditional like refined sugars or anything, so it is nice as a little dessert, I think.
Yeah, nice little refresher.
Yeah.
What advice would you give for women who are curious about the 30-day confinement period? What benefits do you take personally from your experience that you would like to share to other women in learning about this and incorporate it into their postpartum experience?
What I took away from this was just being able to fully rest and recover and being allowed to do that, really. Because I think there is this whole bounce back trend for women. Like, you've had a baby, how fast can you bounce back? How fast can you get back to work? How fast can you get back to caring for your family, get back to exercise, get back to cooking, get back to walking outside, whatever it is for you. How fast can you get back to that? And that is kind of a measure of success for some women.
Mm-hmm.
How fast they can get back to their old life. And so having this confinement period creates a little bubble for you to be like, actually bouncing back can happen later on, where right now it's all about just nourishing myself and understanding what my needs are, what my baby's needs are, and kind of trying to get in tune with them. So for me, that was the biggest positive of what I enjoyed, was that I could just have a moment in time where it was all about understanding my postpartum self versus just trying to get back to my prenatal self, because it is so different. I didn't realize how much of a different person I would be once I'd given birth. And you don't even realize that. Well, I didn't even realize that after I had given birth. I was just in like a different world as well. So now looking back, I can recognize that I really needed that time to connect in with myself again.
So much of what you say is really resonating with me and brings me back to the postpartum period. And I love that you had that space, and I love that you had the family to support you with the transition and to sit with yourself and be with yourself and heal and slowly integrate into the new you. That's beautiful.
It was a really transformative experience for me. And it got me thinking. I just did a live Instagram live last Sunday about how women can just, incorporate this into their modern lives, because not everybody is going to have the means to have a stay-at-home mother-in-law or mother or caregiver to look after you right after birth, whether that be you don't have the family around you or you don't have the financial means to hire somebody to do that. So I was very lucky in that respect. How can other women do this for themselves, essentially? So my advice really would be to create that 30 days and tell your friends and family that you are going to be out for 30 days, essentially after birth, and you would love to see them afterwards. So not telling them that they can't come, but just telling them like, hey, I would love to see you after I've recovered for 30 days. I'm just going to be observing some rest and recovery during this period of time. And that means that you're not getting an onslaught of visitors when, baby's sleeping, you're trying to sleep, or you're trying to connect with yourself. Then the other thing I would suggest would be making meals ahead of time. So, for instance, in my ebook, there is a lot of really great recovery meals in there. You can find many, many online, which would really help women to recover. So making them ahead of time and freezing them into like day 1, day 2, day 3, day 4 would be really, really helpful for women, I think, because you can just take it out, heat it up, and eat. So you're not worried about cooking for yourself. Another one would be maybe hiring a cleaner once a week or once every 2 weeks to just come in and help you just tidy up. So then you can take that mental load off of yourself of having to tidy up and clean up around you. And rather you can just focus on yourself. Yeah, I think just recognizing that your body is going to go through a massive transition. You do need that time to recover, even if you have amazing birth where you have no pain relief and you have a 4-hour birth and baby was out and you're back at home and you feel amazing. Your body is still going to go through a massive hormonal change, physical change, and emotional change. So just having that time to honor yourself and realize who you are is going to be the most beneficial thing for you.
Thank you so much for sitting with me and opening up and sharing your birth story and the confinement period, talking about the transition that goes into pregnancy and the postpartum period. All of that resonated with me profoundly. So thank you so much for doing this interview.
Thank you so much for having me, Stephanie. I hope I didn't talk your ear off. I feel like I have a lot of knowledge and everything that I want to share with you and everyone. So I really hope that somebody has found this helpful, and wish anyone who's listening to this podcast the most amazing luck and well wishes and love going forward into your pregnancy or your postpartum period as well.
Thank you so much.
Please follow us on our social media platforms at maternal_wealth on Instagram and Maternal Wealth on Facebook. Visit our website at www.maternalwealth.com to sign up as a maternal wealth provider or search for maternal wealth providers near you. Lastly, check out our birth course, where I discuss how hospital staffing, policies, and access to medication can affect your birth experience and outcome. Stay strong, stay empowered, and remember, you got this.